cases in LA County have been associated with reported travel to a country where dengue is commonly spread. These additional cases of local virus transmission are an important reminder for all of us in LA County that simple steps to prevent mosquito breeding and mosquito bites can lower the risk of mosquito-borne diseases like dengue and prevent more sustained transmission in the future. Public Health is conducting door-to-door information with the local vector control agency to enhance surveillance and engage residents in the immediate vicinity where cases have been identified. Outreach teams have been visiting and will continue visiting residents in the neighborhood of the identified case to share information about dengue risk in English and Spanish and other languages as needed, and encourage residents to take protective measures against mosquitoes. Our teams are also offering free dengue testing to all the households they visit. With the detection of these 2 additional cases in the region, Public Health will expand our outreach response to the additional households who are within an 150-meter radius of the newly identified cases. It's 150 meters because this is a typical flight range of mosquitoes that transmit the virus. If our public health team visits your home, please allow them to share information with you and help us by responding to a short survey to assess if anyone in the household has symptoms or a recent history of travel. Public Health is also sharing information with providers and encouraging them to stay vigilant for dengue fever and to test for and report suspect cases of mosquito-borne diseases. While the widespread transmission of dengue remains low, we do urge residents, particularly in Baldwin Park, to take simple steps to reduce exposure to mosquitoes. These include using insect repellent to prevent mosquito bites, and I have a little packet. Pretty easy, need to put it on when you're outside. We also say eliminate standing water around your house where mosquitoes can breed. They can breed in a sort of thimble full of water, so you got to get rid of all of the water. And keeping your house mosquito-free by using or fixing screens on doors and windows. I'm now going to turn it over to Dr. Halai, who will provide additional information on dengue symptoms and transmission.
Thank you, Dr. Ferrer. I'm Ayman Halai, and I'm the director of the Vector-Borne Disease Unit at Acute Communicable Disease Control Program at Los Angeles County Department of Public Health. As Dr. Ferrer mentioned, the cluster of locally acquired dengue cases is unprecedented because it has never occurred before in LA County or in California. Dengue is a viral infection that is transmitted by 4 closely related but distinct dengue viruses: dengue virus 1, 2, 3, and 4. About 1 in 4 people infected with dengue will get symptoms, which can range from mild to severe. Symptoms usually appear within 5 to 7 days of a bite of an infected mosquito. The most common symptoms are fever with non-specific signs and symptoms such as a rash, muscle aches, joint pain, bone pain, headache, and pain behind the eyes. Symptoms of dengue typically last 2 to 7 days, and most people will recover in about a week. However, 1 in 20 people with symptomatic disease will develop severe dengue, which can be life-threatening. Severe disease can lead to severe bleeding, shock, respiratory failure, and organ impairment. Infants less than equal to 1 year of age, those 65 years or older, pregnant persons, and those with certain underlying medical conditions are at highest risk for severe dengue. Infection with one dengue virus usually leads to lifelong immunity from that specific dengue virus and short-term cross-protective immunity from other dengue viruses. This means that a person infected once can be infected again. Second infection with dengue is a risk factor for severe disease. However, any infection can cause severe illness. There's no antiviral medication to cure the disease. Treatment is supportive, consists of fever-reducing medications, management of complications, and fluid replacement to prevent shock. Severe disease requires hospitalization for appropriate management. There is one dengue vaccine, Dengvaxia, that has been approved in the United States, but is not recommended for U.S. travelers or those residing in areas where dengue commonly does not spread. As dengue commonly circulates in the tropical and subtropical areas of the world, and LA County residents frequently visit those areas, travel-related dengue cases occur every year. In 2024, to date, Public Health has identified 82 cases of dengue associated with travel among LA County residents. This is higher than previous years and reflects the record number of dengue cases and dengue transmission occurring in Latin America and elsewhere in the world. Local transmission occurs when a traveler who has been infected with dengue while abroad returns to LA County and gets bitten by a local mosquito that then becomes infected. This now infected mosquito can then bite an individual that has not traveled, resulting in a locally acquired case. The transmission can increase rapidly if additional mosquitoes are infected that bite more people. Our goal is to prevent additional spread by identifying cases and by working with our vector control partners to reduce mosquito populations in areas where local spread has been identified. Locally acquired cases and outbreaks have occurred in other parts of the United States, such as Florida, Texas, and Hawaii. These have been relatively small and limited. At this time, this cluster in LA County also appears to be limited. However, our investigations are ongoing. In LA County, we also see West Nile virus. Although it is spread by a different mosquito than dengue, it also was a new locally transmitted mosquito-borne disease when it first emerged in LA in 2003. West Nile virus now regularly occurs and is the most common mosquito-borne disease in LA County. West Nile virus causes illnesses and deaths each year. An average of 55 cases per year of West Nile virus disease in LA County residents have occurred over the last 5 years, but this has reached over 300 in some years. To date, there have been 12 cases of West Nile virus in 2024. The increased presence of mosquitoes and the threat of mosquito-borne diseases changes the way of life for LA County residents who have not had to worry about these diseases previously. Mosquito-borne disease is a reminder that mosquitoes aren't just an annoyance, but can make people sick. It is imperative for all of us to take measures to protect ourselves and our families by using insect repellent and controlling mosquitoes in and around our homes. Thank you.
Can you spell your name, please?
Halai. Halai. That's my last name. Ayman. A-I-M-A-N. I will pass it over to Jason Farned, who's the district manager of San Gabriel Valley Mosquito and Vector Control District.
Thank you, Dr. Halai. Good morning, everyone. My name is Jason Farned. I am the district manager for the San Gabriel Valley Mosquito and Vector Control District. The district is working closely with the Los Angeles County Department of Public Health to continue enhanced mosquito surveillance and control measures in the affected areas. In addition, we are actively engaging in public outreach and education to help residents eliminate mosquito breeding sources and protect themselves from mosquito bites. Our primary goal is to reduce mosquito populations as much as possible and to continue testing mosquitoes to detect mosquito-borne diseases. To date, all mosquitoes tested in the San Gabriel Valley have tested negative for dengue. Our team is currently conducting door-to-door property inspections in the impacted areas to eliminate mosquito breeding sites and to provide essential information on mosquito exclusion and bite prevention. If our staff visits your home, granting access to your backyard will significantly enhance our ability to reduce mosquito populations and prevent potential infections. We remind residents that mosquitoes breed in standing water and only need 5 to 7 days to grow from egg to adult. So we urge everyone to follow 3 simple steps: tip, toss, and protect. Tip out standing water at least once a week. Even a small amount of water, like that found in a bottle cap, can grow mosquitoes. Toss any unused containers that may collect water in the future. And protect yourself from mosquito bites by using repellents containing EPA-approved active ingredients. Ingredients such as DEET, picaridin, IR3535, or oil of lemon eucalyptus. And I cannot stress this enough. The best way to protect yourself from mosquito-borne disease is to prevent mosquito bites. And the best way to prevent mosquito bites is to use an effective mosquito repellent. For more information about our services and additional guidance on mosquito prevention, please visit our district website at sgvmosquito.org or give us a call at 626-814-9466. Thank you very much. And next, I will pass the mic over to Mayor of City of Baldwin Park, Emmanuel Estrada.
Good morning, everybody. My name is Emmanuel Estrada. I am the mayor of Baldwin Park, and I want to thank you for joining us today. I want to extend my heartfelt thanks to our esteemed partners, Dr. Barbara Ferrer from Los Angeles County Department of Public Health, Dr. Ayman Halai from the Acute Communicable Disease Control Program, and Jason Farned, District Manager for the San Gabriel Valley Mosquito and Vector Control District. Your dedication to safeguarding our community's health is invaluable. As noted by previous speakers, the presence of locally acquired dengue cases is concerning, particularly since such cases are extremely rare in LA County. I want to assure our residents that the City of Baldwin Park is taking proactive measures in close collaboration with our county partners. We are working closely with the Los Angeles County Department of Public Health and the San Gabriel Valley Mosquito and Vector Control District to respond swiftly to this situation. Protecting our community is a shared responsibility, and I encourage all residents to take practical steps to safeguard themselves and their families. The simple actions discussed today can significantly reduce the risk of mosquito bites and prevent mosquito breeding. You may notice public health or vector control staff visiting neighborhoods, and I urge you to engage them. They are here to provide crucial information and support, and your cooperation can make a significant difference. The City of Baldwin Park is committed to ensuring that all residents receive accurate information and access to necessary resources in order to stay safe. Our goal is to protect public health, prevent further transmission, and keep our community informed every step of the way. Please stay tuned for updates from our local public health department, and don't hesitate to reach out if you have any questions or need assistance. Together, we can mitigate the impact of the situation and keep Baldwin Park safe. In closing, while the presence of locally acquired dengue cases is concerning, we are taking all necessary measures to address the issue and protect our community. Thank you. I will turn it back to Dr. Ferrer.
Thank you so much, Mayor, for being with us, but more importantly, for the partnership. It's now my honor to go ahead and introduce Andrea Moreno, who's the District Director for Supervisor Solis. And as I noted early on, Supervisor Solis has been one of the strongest partners for public health for decades now, and we're honored to be able to work closely with their team to make sure this community has the resources they need.
Thank you, Dr. Fair. Good morning, everyone. My name is Andrea Moreno. I'm here on behalf of Supervisor Solis. She represents the 1st District in Los Angeles County, which includes Baldwin Park. The supervisor wants to extend her gratitude to Dr. Fair and the Department of LA County Public Health for organizing this important briefing. She would also like to thank Baldwin Park Mayor Emmanuel Estrada, District Manager of the SGV Mosquito and Vector Control District, Jason Farned, Dr. Halai, and Jose Escobar from the Department of Public Health, and all of you here today. We are concerned about the cluster of dengue cases identified in Baldwin Park and want to prevent the number of cases from growing. As you may know, dengue is contracted through the bite of an infected mosquito, and although it is not common in LA County, it is possible that there are other mosquitoes infected with dengue in our community. This is why prevention is very important, and luckily, there are ways you can prevent the presence of mosquitoes in and around your home. This includes getting rid of standing water where mosquitoes can breed, as well as utilizing mosquito repellent and long-sleeve shirts, pants to prevent mosquito bites. However, there is no need to panic. The supervisor is committed to ensuring the county is adequately reaching all of our communities so that everyone has the necessary information and resources to keep themselves and their loved ones safe. We will be working with the Department of Public Health and everyone here today to continue to extend preventative measures, as well as raise awareness around this important issue so that our residents can access testing, identify symptoms, and reduce the presence of mosquitoes in and around their homes. Your health and safety is our priority. Briefly in Spanish. Brevemente en español. Buenos días a todos, mi nombre es Andrea Moreno, estoy aquí de parte de la supervisora Hilda Solís. Ella representa el primer distrito en el condado de Los Ángeles y incluye Baldwin Park. La supervisora extiende su agradecimiento a la doctora Ferrer y al Departamento de Salud Pública con el condado por organizar esta importante sesión informativa. Estamos preocupados por los casos del dengue identificados en Baldwin Park y queremos evitar que el número de casos crezca. Como quizás sepan, el dengue se contrae mediante la picadura de un mosquito infectado y aunque no es común en el condado de Los Ángeles, es posible que haya otros mosquitos infectados con dengue en nuestra comunidad. Por eso, la prevención es muy importante. Afortunadamente, existen formas de prevenir la presencia de mosquitos alrededor de su casa. Esto incluye deshacerse de agua estancada donde los mosquitos pueden reproducirse. Además de crear conciencia sobre este importante tema, la supervisora Solís está comprometida a que todos tengan la información y los recursos necesarios para mantenerse seguros a sí mismos y a sus seres queridos. Esto incluye acceder a pruebas, identificar síntomas y reducir la presencia de mosquitos dentro y alrededor de sus hogares. Su salud y su seguridad son nuestra prioridad. Muchas gracias otra vez de parte de la supervisora Hilda Solís.
Muchas gracias, Andrea. Ahora voy a introducir a José Escobar. I'm introducing José Escobar. He is the Regional Health Officer for this area, and he will also do a brief overview in Spanish. José, muchas gracias.
Buenos días a todos. Soy José Escobar, el oficial regional de salud del Valle de San Gabriel del Condado de Los Ángeles. Gracias a todos por acompañarnos esta mañana. Hoy compartiremos información importante sobre nuestra investigación y respuesta a un número de casos de dengue adquirido localmente que nunca hemos visto en el Condado de Los Ángeles. Agradecemos al alcalde Manuel Estrada y a la ciudad de Baldwin Park por su hospitalidad y por la colaboración mientras respondemos colectivamente a esta preocupante situación. También le damos gracias al Distrito de Control de Mosquitos y Vectores del Valle de San Gabriel por su colaboración continua y sus esfuerzos a la comunidad. Hoy les brindaremos una actualización sobre casos adicionales de dengue adquirido localmente identificado en la ciudad de Baldwin Park y lo que Salud Pública, el Distrito de Control de Mosquitos y Vectores del Valle de San Gabriel y la ciudad están haciendo para garantizar que las personas estén conscientes de la situación y tengan la información necesaria para evitar mayor transmisión del virus. Para empezar, Salud Pública reportó inicialmente un caso confirmado de dengue adquirido localmente el 9 de septiembre de este año en la ciudad de Baldwin Park. Esta semana se identificó 2 casos adicionales en personas que viven en Baldwin Park. Estas personas no tienen antecedentes de viajes a áreas donde el dengue se transmite comúnmente antes de tener síntomas. Con estos 2 casos adicionales se eleva a 3 el número total de casos adquiridos localmente en el Condado de Los Ángeles en el 2024. Las ciudades de Long Beach y Pasadena confirmaron previamente casos de dengue adquirido localmente en el otoño del 2023. Este es un número de casos de dengue adquirido localmente en la misma área que no se ha visto previamente en una región donde el dengue no ha sido transmitido comúnmente por mosquitos. El dengue es una enfermedad causada por un virus que se transmite a personas por las picaduras de un mosquito Aedes infectado. El dengue no se transmite de persona a persona. Aunque los mosquitos Aedes son comunes en el condado de Los Ángeles, los casos de dengue transmitidos localmente son extremadamente raros. La mayoría de los casos en el condado de Los Ángeles se han identificado en personas que han viajado a áreas donde el dengue ocurre comúnmente. Estos casos adicionales de transmisión local del virus son un recordatorio importante para todos los residentes del condado de Los Ángeles de que hay que tomar medidas simples para prevenir la reproducción y las picaduras de mosquitos y así reducir el riesgo de enfermedades transmitidas por mosquitos y prevenir una transmisión más sostenida en el futuro. Salud Pública está trabajando con agencias locales del control de vectores para mejorar la vigilancia e involucrar a las comunidades afectadas. Nuestros equipos están visitando a las personas que viven en los vecindarios en donde fueron identificados estos casos para compartir información sobre el riesgo de contraer dengue y también para motivar a las personas que tomen medidas para protegerse contra los mosquitos. Nuestros equipos también ofrecen pruebas de dengue gratuitas a todos los residentes visitados. Con la detección de estos 2 casos adicionales en la región, Salud Pública ampliará nuestra respuesta a hogares adicionales dentro de un radio de 150 metros de los casos recientemente identificados, que es el rango de vuelo típico de los mosquitos que transmiten este virus. Si nuestro equipo de salud pública visita su hogar, le pedimos que les permita compartir información con usted y hacerle una breve encuesta que nos ayudará a evaluar el nivel de hogar, la presencia de personas que tienen síntomas o personas que han viajado a lugares donde el dengue es común. Salud Pública también comparte información con los proveedores de salud y los alienta a mantenerse alerta ante el dengue y realizar pruebas y notificar casos sospechosos de enfermedades transmitidas por mosquitos. Aunque el riesgo de transmisión generalizada del dengue sigue siendo bajo, Salud Pública le pide a los residentes que tomen medidas sencillas para reducir contacto con los mosquitos. Estas incluyen usar repelente de insectos para prevenir las picaduras de mosquitos, eliminar el agua estancada alrededor de la casa donde los mosquitos pueden reproducirse y mantener su hogar libre de mosquitos usando o colocando mosquiteros en puertas y ventanas. Muchas gracias.
Muchas gracias, Jose. I'm also going to have Emma Chen come up, and she's going to very briefly talk in Mandarin for the residents who live here who speak Mandarin.
大家早上好，感谢您今天抽出时间来加入我们。我们将分享有关我们正在进行的调查和应对洛杉矶县前所未有的本地感染登革热的最新信息。首先，我们想要花点时间感谢 Baldwin Park 市的市长以及 Baldwin Park 市感谢他们的热情好客和合作。我们将共同解决这一令人担忧的情况。我们还
在社区中持续的合作和努力。今天我们将提供有关 Baldwin Park 市新增的本地感染登革热病例的最新信息，以及公共卫生部门、圣盖博谷文区和市政府正在采取哪些措施，以确保居民了解情况并掌握防止进一步传播合适的信息。首先，公共卫生部门在今年的2024年的